So, what is your name?
My name is Jitendra Agrawal.
And can I know your designation?
I am a businessman.
Okay, so I am going to ask you some few questions. And the first question is, do you currently reside in a rural area? Yes or no?
No,
Okay. My second question is, have you ever experienced challenges in accessing healthcare services in your rural community?
I didn't get the question.
Have you ever experienced challenges in accessing healthcare services in your rural community? Yes or
Yes,
no?
yes.
Okay. Now I am going to ask you some multiple choice questions. What of the following best describes your level of satisfaction with the quality of healthcare services in your rural area? Satisfied, very satisfied, neutral, dissatisfied, very dissatisfied.
Neutral.
Okay. Is the nearest healthcare facility in your rural area more than 10 miles away from your home? Yes or no?
No.
Okay. What types of health services do you believe are lacking in your rural community? Primary care, specialized care, mental health services, dental care, none.
Specialized care.
Which of the following factors do you believe most significantly hinders healthcare access in rural areas? The options are lack of healthcare facilities and providers, limited public transportation options, insufficient health insurance coverage, socioeconomic factors, other.
Socio-economic factors.
Okay. Now I am going to ask you some agree or disagree questions. So please indicate your agreement with the statement. Accessible healthcare is a fundamental right for all individuals regardless of where they live. Strongly agree, neutral, disagree, strongly disagree.
Strongly agree.
Okay. Do you agree or disagree with the following statement? The statement is improved healthcare access in rural areas can contribute to all the overall development of these communities.
Yes, strongly agree.
Okay. Now I'm going to ask you some subjective questions and can you share an example of a time when you or your someone you know faced challenges in accessing healthcare services in a rural area? Please describe the situation.
Actually, many a times I had faced this situation because I am a native of Kalahandi district. Right now I am residing in Bhubaneswar. So while residing in Kalahandi district, we had faced number of times the challenges due to the lack of healthcare facilities in our neighboring area, and we had to move towards a city or a neighboring town to have access to even primary healthcare services. So at that time we also think that there is a much lagging of healthcare facility in rural areas.
Okay. And my last question is, in your opinion, what specific steps or initiatives should be taken to enhance healthcare access in rural communities? Please provide your some suggestions.
No, there must be every each and every in each and every block there is one hospital, I think, in Odisha, but the hospitals lacks the basic facilities, like they don't have qualified doctors, and the quality doctors don't want to go to that area and leave because of the lack of other facilities also. So I think there should be one more thing, there is no sample connection facility also till now in remote rural areas. So simple blood test also has to be happened in a quite suburban area. So health being, I think healthcare is a very fundamental right for each and every citizen of the country, and for that rural areas has to be rural communities must access this facility in their own neighborhood, and I think many things are there that needs to be done in rural areas. One thing ki proper specialized care that needs to be taken care of, because primary health care, okay, its facility is there, okay, but specialized health care, mental health care, what all options you have put up, all those things are lagging too much. So there is lots of work needs to be done in this sector, and government as well as private partner has to shake hands so that the healthcare facilities can be improved, and in near future we can envision a greater India with healthcare for all. That's it. Thank you.
Okay, thank you very much, sir.